Roughly 1 in 4 children has dental fear, and it's highest in the youngest kids, about 36% of preschoolers.
Dental fear in children, from empathy to empowerment. Look, if you're a parent, hearing those numbers probably doesn't shock you, right? But it definitely pulls at your heartstrings. Seeing your little one in distress, especially at the dentist, it's incredibly tough. But here's the really good news. Dental fear is absolutely not a permanent state. And as parents and caregivers, we have a huge amount of power to completely flip the script. In this explainer, we're going to unpack the actual root causes of childhood dental anxiety. We'll explore the proven clinical strategies that pediatric dentists use every day to combat it, and give you some really concrete, actionable tools to transform your child's next visit from a stressful ordeal into a calm, empowering experience.
Okay, let's dive right into this. Section 1, Deconstructing the Fear.
So to actually conquer a fear, we first have to understand exactly what the child is experiencing on a psychological level. I mean, it's so easy to look at a crying, squirming kid in a dental chair and just see bad behavior, right? But it's absolutely crucial to separate two concepts that we constantly confuse. We have dental anxiety, or DA, and dental behavior management problems, or DBMP. So dental anxiety, that's the internal emotional state. It's that invisible feeling of dread, that unwarranted anxiety over a procedure. It is entirely internal. On the flip side, DBMP is the external, uncooperative, sometimes really disruptive physical reaction you actually see happening in the chair. Now, they are highly related. One usually triggers the other, but they are distinct. Recognizing that a child's disruptive behavior is actually just a physical manifestation of deep internal fear, that changes our entire approach. It shifts our reaction from frustration straight to empathy. And when we isolate exactly what drives this intense internal fear, the data points to one very specific trigger: the needle and the injection. For a kid, the unpredictability of a dental visit is scary enough on its own, but the anticipation of pain, specifically centralized around the injection, is literally the single most fear-evoking part of the entire visit. It's the primary hurdle. Think about it. When a child lacks control in a totally unfamiliar environment, and then you introduce the possibility of a needle, that internal anxiety is going to quickly bubble over into external behavioral problems. Understanding this gives us total clarity on exactly what we need to help them overcome. Let's move on and see how this builds in Section 2, the clinical gold standard. So dentists don't just rely on hoping a child is going to be brave. They actually use a highly structured, evidence-based approach to manage this fear. For decades, the non-pharmacological gold standard in pediatric dentistry has been a technique known simply as tell, show, do. It's elegantly simple, but highly, highly effective. Step 1 is tell. The dentist explains the procedure using simple, totally non-threatening language that fits the child's age. Step 2 is show. The dentist demonstrates the visual, the auditory, and tactile aspects of the tools in a safe way, like showing them how the water squirter feels on their hand first. And step 3 is do. The dentist performs the procedure exactly as they just explained and demonstrated. This completely removes the element of surprise and gives the child this much-needed sense of predictability and control. But tell, show, do doesn't operate in a vacuum. As outlined by the American Academy of Pediatric Dentistry, it's actually supported by a whole framework of graded communicative guidance. Dentists use positive reinforcement, praising very specific good behaviors like sitting still. They use distraction, shifting the child's attention to a screen, a story, maybe a game, to route their focus away from the scary stuff. And they use desensitization, gradually exposing the child to the clinical environment so it becomes totally normal rather than weird and novel. Together, these techniques build trust, they safely distract, and they effectively manage mild to moderate anxiety right there in the clinic. Which brings us to Section 3, Experiential Learning Breakthrough. Now, researchers have recently discovered that we can take clinical preparation a massive step further. We don't actually have to wait until the child is already in the clinic to start reducing their anxiety. There was this fascinating cluster randomized trial published in BMC Oral Health that explored exactly this by moving the preparation right into the classroom. Researchers took kids aged 7 to 8 and introduced them to experiential learning. A full month before their actual dental visit, these kids got a lively presentation on oral health. But here is the real magic part. They then engaged in simulated dental clinic role play right there in their classroom. In groups of 4, they took turns playing the patient, the dentist, the nurse, and the parent around a simulated dental bed. They handled the mouth mirror, the dental probe, the ejector, all in a completely safe, low-stakes environment. Basically, they were learning through play. And this brilliantly illustrates the impact. The results absolutely speak for themselves. When it came time for their actual dental procedure, which was a pit and fissure sealant, the prevalence of high dental anxiety in the kids who only received the standard tell, show, do technique at the clinic was 24.3%. But for the kids who participated in that experiential learning role play a month prior, high anxiety dropped significantly, down to 18.5%. They even had lower spikes in blood pressure and heart rate. By letting children experience the tools and the process before facing the unpredictable anxiety of the real clinic, they gain this massive sense of self-efficacy and control.
So, what can we do at home? Section 4, How Parents Can Prepare.
The great news here is you don't need a formal school program to harness the power of experiential learning and desensitization. You can literally do this at home. Here are some concrete steps you can take to set your child up for a win. First, establish a dental home early, ideally by 12 months of age, because early preventative care means fewer negative experiences down the line. Second, and this is a big one, be incredibly mindful not to project your own dental anxiety. Children are like emotional sponges. If you talk about the dentist with dread, they are absolutely going to feel it too. Third, steal a page right out of that BMC oral health study. Practice role play at home. Have them lie back on the couch, grab a clean toothbrush to count their teeth, and let them play the dentist for you. Make it fun. Finally, use positive pre-visit imagery. Show them positive pictures or even videos of the dental office before you go, so they know exactly what to expect.
So the crucial point is this: preparation is your best tool, but you are part of a team. If you have a child who exhibits extreme, unmanageable fear despite your absolute best preparation, communicate that openly with your pediatric dentist beforehand. Ask the dentist about additional support or specialized behavior guidance techniques for a highly anxious child. But please remember this: never diagnose the child yourself. Always let the professionals evaluate whether the child's reaction is just standard situational anxiety or if it's something that requires a slightly different clinical approach.
All right, let's wrap this up. Building fearless dental habits.
Ultimately, a successful dental visit is a three-way partnership. Empathy is what allows us to see past that challenging behavior to the real fear hiding underneath. And when we combine clinical strategy with solid at-home preparation, we completely remove the mystery and the dread from the dental chair. Because when a child actually understands what is happening and feels a genuine sense of control, their fear simply cannot survive.
The tools are right there in your hands, and the science proves that they work. So I'm going to leave you with this question. How will you reframe your child's next dental visit from a source of fear to an opportunity for empowering play? Thank you so much for exploring this explainer with me, and remember, Fear Me Not helps kids conquer fears through play.